right, what the heck are Medicare prescription drugs? Well, we're going to look at that, and even though I've got several videos on Medicare Part D, we're going to look at it again because this is number 6 in a series, the Medicare and You Handbook 2020. I read it so you don't have to. Okay, we've been talking about in the last few videos, we talked about Section 4, which is Medicare Advantage Plans, and that's 14 pages in the book. Then we talked Section 5, which is the Medicare Supplement Plan, that's 4 pages. And now we're up to Section 6, which is Medicare Part D, also known as Medicare Drug Plan, that's 10 pages. Okay. Okay, the Medicare Advantage, 14 pages, that's pretty complicated stuff. Medicare Supplement Plan is 4 pages. It's much easier to understand, and everybody likes it that way. At least I do, and my clients do. Medicare Section 6, the Medicare Part D, has got to be one of the most convoluted programs for anybody, but even convoluted for the government, for crying out loud. I mean, after all, the program was implemented in 2006. Congress drafted the rules for a plan that they would never use because they have their own plan. They're not part of Medicare. So Congress drafted the rules, and then they turned it over to, and they don't understand it either. They can't explain it. Go call your congressman and say, could you explain this to me? They have no idea. They have no idea. But Congress drafted the rules for Medicare Part D drug plan, and then they turned it over to the insurance company to manage. What could possibly go wrong there? Just about everything. I'm here to tell you, I have been in the health insurance business for over 45 years. I'm on Medicare myself. I have devoted the last 10 years, since 2010, to working exclusively with Medicare clients. And of all the parts of Medicare, and it was a learning curve for me because the terminology and so forth is a little bit different, and certainly the functionality of Medicare versus regular health insurance is also different. In a lot of ways, if you're dealing with original Medicare, it's much more simple. If you're dealing with Advantage plans or drug plans, there ain't nothing simple there, let me tell you. But the Medicare Part D plans, I have discovered that not only do most of the people who are looking at drug plans, most of them have no idea how they work. They think, well, they're all the same. Let's just pick the plan with the lowest cost, especially if it doesn't have a deductible, and that's the one I ought to go with. And by the way, honey, you ought to have the same plan because I know we're going to get a discount on that. And it doesn't work that way. It really doesn't work that way. I'm not going to get into all the details because I've got, a dozen or so other videos specifically on Part D. But let's just say that, and I've said this before, but it certainly bears repeating, most of the insurance agents, this was a surprise to me, but I discovered this a couple of years ago. Most of the insurance agents, at least the ones that participate in a rather large national forum that I participate in, most of the insurance agents have no idea how Medicare Part D works. They can't explain it. That's why a lot of them simply say, well, you don't want to plan with the deductible, do you? Let's go over here and go with this one. And so a lot of times people end up paying $25, $35, $50 a month or more for a plan that does not have a deductible, when they would not only have a significantly lower premium by going with a plan that has a deductible, they actually have lower co-pays too. Yeah, that's go figure that one out. That's a real head scratcher. So if you talk to an insurance agent, or God forbid you talk to an insurance carrier, or even somebody at 1-800-Medicare, and you took their advice on a drug plan, you probably are paying too much. I mean, that's about all I can say about that. So, Medicare Part D, It is in Section 6 of the Medicare and You Handbook. Remember, I read it, so you don't have to. But if you want to read it, you can, and good luck trying to explain it, trying to understand it. Hey, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.